Hello everyone, welcome to the new episode of Professionals Unplugged. I am your host Utkarsh and let me introduce you to my guest Nicholas. Nicholas, thank you so much for joining in.
My pleasure, Utkarsh. Great to be here this morning or this afternoon for you.
Thank you so much, Nicholas. So let's start with our very basic question. Can you please introduce our audience about yourself, like who you are, what work you do, anything about you?
Great. I'm Nicolas Turrin. In about four words or a bit of my description is I would say I'm a patient and quality professional. I'm also a scientist, and I would say I'm a change agent. All of this is from the different backgrounds that I've accumulated through first being a health research scientist when I started my career many years ago, which shifted when we decided to move to the Middle East, where I started being a clinical risk manager for a private and as well as the public system that was there. And I quickly learned there that I also had to become a change agent, as if you're just trying to advocate and you can't cause change, you're not able to go forward. And all of this kind of accumulated into the current position that I have right now when I moved back to Canada last summer and became a change consultant for a firm here that works on patient safety, quality, and change management for the whole country.
That is really awesome. This is a role I'm hearing for the first time, like a patient's consultant or like a patient. So can you just enlighten us on the same, like what's the main role behind this?
Well, the main role is we mostly consult, the company Salus Global mostly consults with the different hospitals across the country, and we focus on obstetrics and making sure that we have safe care for the patients that are pregnant as well as their babies. And we do this by finding the gaps that they have in their care, promoting best practices. So we're backed by our stakeholders, have a lot of resources related to making sure that we can offer the best care to the patients. And we also make sure that we train the teams so they're also able to sustain their change, the quality of their care. So we basically say we take teams of experts and make them into expert teams. So obviously change, you can't do it alone. You need to be part of a team to do it. And you want your whole team to be able to drive it. So that's the philosophy of what we're doing right now.
That's really awesome. So, any story you like to share from your experience till now as a scientist or as the same role? Anything you like to share?
Yes. And I would say what happens is, you get to a crossroad at a certain point where your education, your experience, your background, and kind of like your ideology of what you're supposed to be doing kind of hits. And it happened when I changed hospitals when I was in Abu Dhabi. And, we all hear about that famous elevator speech where you step on the elevator and the CEO of the company is there. And you've got to tell, and he asks you the basic question is, he's like, you're the new guy. So what do you do? And I remember because our elevator only goes on 3 floors. So I didn't have a lot of time. So I'm saying, I'm going to be in charge of patient safety and risk. So I think we're going to take a step back. And as soon as I said we're going to take a step back, he says, Nick, you don't understand. Here we go fast. We don't have time to take a step back. So my scientist mind says, but I need to ideate. I need to think. I need to stew on things. But then the patient safety side of it says, well, patients are at risks every day. So you need to do things fast. So it got me to thinking about that balance and saying, you've got to be able to stop and think, but do it while you're still running. So you kind of just jog instead. It's like intervals. So it was interesting at that point. It's when I decided that you've got to be able to manage change and to do it in a safe way, but also to do it in a thoughtful way. So that was kind of the story where I decided that I needed to meld all of those, the experience, the background that I had, and try to make it work for not just for my own philosophy, but for the institutions I was working with.
That's really awesome. And the way you have mentioned, like how your scientist ideology and your neural ideology, both of them are in a contrast, because as a scientist or as an engineer, you need to first ideate things, go through their roots, and then take actions, right? So you need to prepare a whole plan there. But in this one, it's totally opposite, right? So
Yeah.
you need to take actions first.
Yeah,
And
and I would say you don't take actions first, but you've got to be able to do the quick fix,
yeah,
the safe quick fix. Make sure that no one's at risk at that moment, and then slow down, but still keep the pace going. Still try to make sure that you keep the momentum of the change, because as soon as you become stagnant, that's usually where you start losing. People start losing interest, or they drift from what you wanted to do. So you've got to keep your teams engaged. You've got to keep your leadership engaged, because you can have a very engaged team, and if the leadership does not believe in what you're doing or doesn't know what's happening, of course they'll want you to close it fast and move on to the next issue. So you've got to show them that you're still doing progress, and that's by showing data, showing evidence of change that you're doing. So of course, safety or quality sometimes some people see as nebulous, but at the same time it's got to be in numbers. You've got to be able to take that CEO that was in the elevator, bring it to the floor, and show them that something's happening.
yeah, that's awesome. I mean, you need to make sure that everyone around you is aware of what you are doing and how things are taking place, right? So that's
Yeah.
it's just, so let's jump to our final question. So, what is your dream right now?
What am I working on right now? Well, in a way, again, we have all the good sides that are hitting. So I'm trying to help our teams of frontline caregivers be able to visualize their data, so that they're able to take decisions on what they have right now as opportunities for improvement or opportunities for change. So I've started by helping them. When they need to do audits, for example, be able to have visual management tools, so that they're able to see what they need to fix. And then on the long run, be able to accumulate those data and be able to see the change that they're doing from, let's say, quarter to quarter or years to years. And they're able to make decisions at that point. But that's at the same time as making sure that the teams are engaged, making sure that my colleagues also buy into this philosophy, because we have to change. We had to do changes to currently we've got about 60 teams that we've changed the way that they used to do things. So when you come into a meeting, you're the new guy and you say, well, we're going to change things.
Yeah.
A lot of work has to have been done by your colleagues to set the nest for that change. It's not something you do alone, and the teams have to be able to accept and adopt that change.
That's really awesome. I think, in short, it's like working in a collaboration in kind of a community and using data insights to provide you a better result, right? And we use the historical data for the analytics and take decisions based on it, right?
Mm-hmm. It's taking decisions on data, and I mean, we've been talking about data a lot, but also there's the human side. It's making sure that the human is doesn't remain the number that you have on screen, because you're going to be talking. You say, well, we have, let's say, 60 cases that we've looked at, but these are 60 patients. In our case, it's not 60 patients most of the time. It's going to be 120 patients, because there's a baby involved. So it's remembering always that you've got to ground yourself, that you're dealing with human beings, both in as data points in a way, and also the teams that are in front of you. You might have 6, 10, or 12 people in the room for which you've got to convey that message at the same time. So the visual side of it is good, because you might have been with them for 4 hours, and then you're saying, well, what have we been doing for the past 4 hours? So having immediate data for them is something that we found was very important, so that they're able to make decisions even when, as we said, you're tired, you can't stop. So you've got to have something to help you make those decisions.
Yeah, that's really awesome. So just one more question I have right now. So how was your journey, like from Abu Dhabi to Canada and as a scientist? And so any comments on it? Was it easy to move between different parts of the world, because both of them are like totally opposite way of the world, right?
They're opposite, but they're the same in a way. So I mean, the differences were different when we moved there, because we were a young family. We had a 6-month-old, and we came back with a teenager and a tween. That also had to be done at the right time. The time had to be right. It was a transition for my older one as he was starting high school. But as a difference between the two, Abu Dhabi and let's say Quebec City, well, they both have one thing is that there's a few months a year where you don't necessarily want to be outside, but not for the same reasons. So the heat, the cold. Also, it was moving from a very multicultural, multilingual environment in Abu Dhabi, and Quebec City is I wouldn't say unilingual French, but French is the language that's spoken. Still a lot of bilingual with English speakers here. So it was transiting to that culture of making sure you're still able to communicate and communicate well with everyone. So my native language is French, but my professional language is English. And you might have that same type of clash that you need to be able to get back and rebuild your vocabulary. So, but the culture is good. I mean, you make it the way you want when you move. You've got to be sure that your family's on board. You've got to make sure that you transit everybody that's moving in the right way, and to set your expectations at a level that you can meet them. If you're idealizing your move, that all your friends are going to show up the first day and you're going to be running the first day that you're there, of course you're going to be setting yourself up for the disappointment.
That's really awesome. Like you have covered everything, I think, for the journey from 1 month of hotness to 1 month of coldness where you can't go out to bring the language. That's really very awesome of you, right, to share your journey with us. So I think, Nicholas, we are done with our questions. So thank you so much for your insight. It was really a pleasure speaking with you. Thank you so much for the interview.
And thank you for the opportunity, and good luck.